Imagine getting an invitation that cordially invites you to not attend. It is the South Carolina Ovarian Cancer Foundation's Phantom Gala. The event is April Fool's Day at 0 o'clock. No black tie, no evening gown, no babysitter, cheap wine, or rubber chicken. But what is real is the cause, and that's to raise money to educate women about ovarian cancer. Dr. Jimmy Williams is with South Carolina Oncology Associates, also known as SCOA. You have been on before talking about some of the warning signs and such. Today I want to look at the fact that New York Times, you brought this article to my attention, is saying that there's a new study showing widespread failure among doctors in the clinical guidelines in treating women with ovarian cancer. That's the case?
That's right. At our national meeting of the Society of Gynecologic Oncologists in Los Angeles in March, there was a paper presented that looked at 13,000 women and how they were treated with ovarian cancer. It was found that 40% of women fell below the standard of what we consider to be the guidelines for treatment of ovarian cancer.
Why is that happening?
There are a lot of reasons that guidelines are very broad, but they don't always collect women who may fall outside of health and other issues and may be too ill to get within the guidelines. But the reality is that not all women get the right treatment for ovarian cancer.
So what do women who are watching right now or their husbands need to tell their wives to do if in fact they suspect or find out that they have ovarian cancer?
Well, the South Carolina Ovarian Cancer Foundation is big into educating women about the signs and symptoms, but the second thing we want to do is make sure women understand that if there's a suggestion or a concern that they may have ovarian cancer, and that really would be provided by their doctor or their provider, then they need to see a doctor who specializes in that. That's what I do for a living. So a gynecologic oncologist specializes in the surgery and the care of women who have ovarian cancer, and that's the most important thing. We individualize care to stay close to those guidelines as it is based on each individual woman's needs, but that's the most important thing.
Go to a specialist who does this all the time.
That's right.
The pap smear, I always remind people, women, that does not catch ovarian cancer, right?
No.
Doing that annual exam, women think it would be caught, but that would be cervical cancer.
Right. The pap smear is very specific for a screening test for cervical cancer, and it's been the most effective screening test in the world and in the history of medicine. But it doesn't do anything to help identify ovarian cancer.
Okay, you can learn more about the signs and symptoms of ovarian cancer and more on what Dr. Williams is talking about, and the Phantom Gala, which I love the idea of not having to buy
Me too.
another dress and heels, and you have to wear a tuxedo and all that. That's on the big red tent on our website. Dr. Williams, thank you as always.
Thank you.